Kathy and Jamie is here again. Good morning.
Good morning, Mr. Chair and Commissioners. I handed out the current information for our data for this week. So you can see that our cumulative cases are up just a little bit. Our cumulative deaths, we have 90 now. Last week we reported 89, but there's a delay in the death report, particularly for this one. So the death was actually from November. So I'm not sure, can't explain how they missed that or how that didn't get recorded. So it wasn't a recent death. It was a death that happened a number of months ago. So they've just put it on the data now. The out of isolation is, correlates with the active cases and those that are out of isolation that recovered. So our active cases, last week we reported 319. So as you can see, this week it's 257. So that's good that we're seeing it go down a little bit. The median age is still 33 for our cumulative cases. Excuse me. Hospitalizations are up. The admissions are up a bit. There's still a little bit of an uptick in hospital cases throughout Minnesota. In the local hospitals across the river, they're still at a manageable rate. We had a few cases from Clay County that were actually in our hospitals in Fargo, and then one that was in ICU. But we haven't seen the large increase that they're seeing across Minnesota. And then our 14-day case rate, and you'll notice that it did go up since the last report last week. So it was 40.45 last week. It's 59.23. But as you see, the case rates are delayed. It's quite a bit after the fact. So this only goes through April 3rd. So this would correlate with the increase in our cases. So we really anticipate that next week we'll see that 14-day case rate go down. So it's a delayed figure. So you can just, anticipate that we'll see a decrease with the active cases decreasing. And then the graph is showing, of course, as you look at the graph, you see, the uptick in March and then in April. So we're hoping again that there will be a bit of a decline there. Our active cases by age on the second page. So the graph is showing that it's the 20 to 39, 34-year-olds, and then the 35 to 39 is up there a little bit too. So we're seeing the number of active cases. And if you look at the side of the graph, it's the number of cases. In this graph, it's 0 to 35. So last week when we looked at it, the number of cases are a bit different because we were way over the 35 or 31. So this is, typical of what our active cases look like, but those are the age ranges we're seeing this week. Cumulative cases, again, are the 20 to 24 age range for the cumulative cases. And then we've really talked about the hospitalizations, again, that there's a few, but they have not seen the increase like we have across the state of Minnesota. And then we talked about the death that was just reported as a delayed report. Any questions on the data?
Any questions? Yes, Commissioner Moore.
Question. I follow several other counties throughout Minnesota, and I've noticed that some counties are releasing active cases per zip code. And I have heard different stories that MDH really doesn't want us to do that, or that data is not really available. I think having that out there would probably be helpful so that folks can see where the hot pockets in Clay County would be. Can you talk about if that's even available, those percentages?
Initially and actually we talked about that early on where Minnesota Department of Health did not want to give that data because You know, they know there's active cases all over, and sometimes you see the pockets, but you may not see some of the other ones based on who's getting tested. I can look into that to see how much work it would be to get it per zip code, and so I can find out if we can get that information from Minnesota Department of Health.
Thank you. I think it would probably, you know, as we continue to look at local plans and moving forward, it would probably be a helpful tool for businesses, but especially the school districts, to see not only what numbers, I mean, they know the numbers that they have within the schools, but they don't necessarily know community-wide, and it might be a possible tool to have.
We provide all of the data to all of the schools, K-12, and then also all of the higher ed, so they're seeing this directly each week. We're sending that to them. So, but I'll check into that, Commissioner Mojo.
Okay. I am here to report on the efforts of public health and vaccinating, and I just want to say, Commissioner Campbell, that we did request that age breakdown for vaccine, and the state has informed us that they can give that to us by next meeting. And so we'll bring that for your request.
Right.
But basically, we are continuing to lag behind in the percentages of those compared to the state average, although each week we talk about the number of Clay County residents who are vaccinated in pharmacies on the North Dakota side, and that information is not coming into the data that we have to share here, so it's kind of a partial picture. Basically, looking at the number of people with at least one dose of vaccine, Clay County is at 37.8% of the population, as opposed to the state at 50%. And the total number of people with a completed vaccine series in Clay County, 28.9%, compared to Minnesota's 36.9%. People aged 50 to 64 with at least one dose in Clay County, 46.8%, and Minnesota 56.5%. And people aged 65 with at least one dose, 73.8%, and 85.4% at the Minnesota level. And then the total vaccine provided by Clay County Public Health alone to date, 12,986. And our total for last week is 1,090 doses, and the great majority of that, close to 1,000, was second doses. Based on the request for first doses, we did request less vaccine this week. We have very little second doses, but we have a total of 626 doses that we'll be giving this week. There's a delay in shipping, so we will have our first clinic in the evening on Wednesday. So we have requested a very small amount of Pfizer vaccine to serve the 16 and 17-year-olds, and so we're doing a clinic from 4:30 to 6:30 to accommodate them, and communicating that through the parents. We also, before we were able to get vaccine, have shared all of the resources on the Minnesota and North Dakota side. Sanford and Essentia have been doing evening clinics on the North Dakota side, so we've made sure that that information was shared with the schools as well. So we're hoping a larger percentage of them have been vaccinated, but we do have some available this week. And then we have a Thursday clinic for 250 first doses, and we also have a Friday clinic for 250 second doses. And so that is our plan for this week.
So Jamie, I have a couple of questions for you. I happened to be on social media earlier this morning, and I saw on there where a comment was made, or a post was made, that there's been hundreds of folks in Minnesota that have gotten the virus after having the vaccination. And I guess I looked for public health for that, and granted, when the vaccination came out, especially the first two, they said that it was maybe 95% effective. That means there's 5% that probably isn't, right? So I guess from my standpoint, I would like to, if you have access to additional information moving forward, because I think most of this the conversation now is about vaccine when it comes to COVID. And so it would appear to me that the more realistic numbers that we can provide the public, probably the less concern there might be. That's my feeling anyway, is that the numbers would show that. You know, so I don't know if we have the ability to, can we get the data that shows how many people have been infected after having the vaccination and what percentage that is to the total people vaccinated? I think that's important for people to know, because they read this and they become skeptical. But I think up front, we've been up front all along in this, that the percentages aren't 100%. It's not 100% there. But I would guess that the numbers that would have been reinfected are even far below the 5% that, you know, in that 95% range. So if you could maybe help us with that regard, just for public information, I think it would be.
We do know, Mr. Chair and Commissioners, there is a lower percentage than 5%, because we've heard that from the state. There are a number of people across the state that are getting the virus again after being fully vaccinated. So there's a few hundred, I don't know an exact number, but it's well below the 5%. So it's not alarming, but we'll get you the exact figures.
Yeah, and I think it's important to track that, because the questions keep coming, and not only that then, but that those that do end up being infected after having the vaccination, how many of them end up hospitalized versus, you know, and compared to how many might have been hospitalized before. I think it's critical to know all the pieces to this. So, you know, I don't know that it was, like they said, these vaccines were never going to be 100% guarantee, but they were certainly supposed to be 100% from being very ill.
Correct.
Right? That's
Right.
what had been out there. And is there anything that has changed that?
Sure, and thank you, Mr. Chair. That information, we can request it. It's not provided, but we can certainly request it through the epidemiologists at MDH. So we'll get that.
Well, I just,
Yep.
you know, trying to gauge a little bit of the pulse of the public. These are the questions that are being asked, or there's theories being presented based on information that I don't know is accurate.
Correct. Yes.
All right.
Yeah. Thank you for that. We'll be sure to get what we can from them.
Okay.
One more comment, please.
Yes.
It's also important to note that the more of us that are vaccinated, the more we can protect those that don't gain as much immunity from the vaccine. So those who are immune compromised or those that are elderly aren't able to fully reach that 94% themselves. So they rely on the rest of us to protect them as well. So.
Okay. Yes, Commissioner Mojo.
Thank you. Early last week, I received an email from our children's school from the superintendent that talked a little bit about vaccinations moving forward, and that in the future, if there is a close contact with your child, if your child has a vaccine, there probably will not be the required quarantine rate that, you know, we've seen in the past 6 months, if and when they open it up to kids. How are we looking at our policy, working with Darren and Steve on staffing and how those staff quarantines will or will not happen based on vaccinations of our employees? Is that something, we're having those conversations now, or?
I think we're having those today, aren't we?
Yeah,
And
Mr.
Pick?
Chair and Commissioner
Darren?
Mojo, yeah, we had initial one conversation, just in general about the
Great.
remote policy, but we'll have more.
Great.
I think, Commissioner Mojo, I think your questions are good, and I think we have it on our agenda for
Great.
today's
deal.
personnel issues.
Well, I think it's important. You know, I certainly feel that we'll have to come out of this pandemic at some point. It's how we plan as safely as possible to do that. I think we've proven that we can still do business, even though we've had some limitations. So I would certainly feel like encouraging our staff to have a vaccination will help going forward.
Thank you. And one other comment, we all know that there's vaccine hesitancy. We hear about that, and there is a lot of information out there that maybe isn't accurate, or there's a lot of conspiracy theories. So we want to make sure that we get the accurate information out, and there's a request to get information to all of our churches, to just, get a wide sweep and provide more accurate information. And so our public information officers from Public Health are working also with the public information officers from Fargo. So the intent is to kind of cover all of the churches across our metro area. So we're actually currently in the process of getting that information out to them. So that's another opportunity for us to provide information to the public.
Excellent. Any more questions or comments? Anything from Kathy and Jamie? Anything else? All right, well, thank you for
Thank
your
you.
continued good work.
Thank you very much.